Therapy is a process of developing self-understanding, self-awareness, and perhaps even new coping strategies to deal with some of the most difficult times in our lives. However, there's still a lot not really known about therapy, and there are also a number of different misconceptions. Guys, welcome to another week's episode of getPsyched, and on this week's episode we're going to be taking a look at what exactly therapy is all about. And at this point, it's probably a pretty good idea to give you a little bit of information on my background. I'm currently a counselling psychologist in training, and my studies and work are focused on one-to-one therapy. I work at a couple of different placement organisations, and I conduct one-to-one sessions with individuals who present with some mental health challenges or even mental illnesses to an extent. I've seen firsthand the benefit that people can get from actually accessing therapy. And part of the counselling psychology doctorate programme that I'm on requires me to actually go through personal therapy myself. So I know what it's like both in the therapeutic sense, being a therapist, and I also know what it's like being a client. So my experience and my understanding of therapy has developed and evolved over the past couple of years, both as conducting therapy sessions and actually gaining benefit from being in therapy myself. So what exactly is the structure to therapy? Well, the truth is that it can vary in structure to huge different degrees actually. The length of sessions often stay very similar, they're around about 50 minutes to an hour long. The number of sessions can vary to a great degree though. You might be on the NHS and you probably receive something towards around about 6 sessions. If you went privately, however, sometimes people are in therapy for years and can have hundreds of sessions. However, always therapy is conducted with one therapist and one client. That of course changes if you're having relationship counselling or family counselling, for example. But more often than not, when we think of therapy, we think of that one-to-one interaction. However, that one-to-one interaction can even be in different formats and can have a different structure of its own as well. Things such as walking therapy, when a therapist and a client go outside and actually have a walk together and conduct their session that way. Therapy can be conducted over Skype online, it can be conducted over a telephone, and there's new research that's starting to come to light that's showing that therapy can actually be conducted via virtual reality. There's a lot of future research to be done on this, but this is a growing field, and it's just an example of how exactly that one-to-one element of therapy can be conducted in different formats. So why exactly do people come to therapy in the first place? Well, one of the main misconceptions about therapy is that people often think that it's a last resort, that it's the end of the road and that you have to be in the worst possible position to actually access therapy. The truth and the reality of the situation is that that isn't true. People come to therapy for all sorts of different issues and to all sorts of different varying degrees. People come for depression and anxiety and relationship issues. People come for low mood or experiencing low mood and challenges in actually understanding their own emotional state. I think that's one of the main misconceptions about therapy, is that people that come to therapy are in a really bad place. And often that is the case, and therapy can be extremely beneficial. But sometimes people can come for therapy for what might initially not be considered as a big issue. Now, I've experienced firsthand that as therapy develops, those smaller issues can actually lead to bigger things, but we don't have to view therapy as a last resort in order to access it. It's also true to say that therapy is different for different people and different groups of people and can have different results. For example, men. Now, this is primarily my main focus on my research as I go through my doctorate, is focused on men's mental health. And I know that things such as masculinity and male identity can make it really challenging for men to actually access therapy. So for that demographic, for that group, actually accessing therapeutic services might not be as straightforward as other groups. There's also other different contexts to therapy. For example, I already mentioned about couples counselling. Now this is of course obviously a little bit different because there's 2 people in the therapy room with the therapist. And due to this, it's the relationship that's the client, not each individual, not the one individual and the other individual. The relationship itself is what the client is. So that can bring on a different format, and we can use that as an understanding to see how therapy can have different formats and as a result have different results for different groups and different needs. So it's true to say that groups such as men and couples as well can experience a different format to therapy and as a result experience different results. But of course, groups such as families actually can access therapy as a whole as well. It can have one family and one therapist working in a counselling session. Now this obviously is a completely different dynamic, it's a different context, there could be multiple people in the therapy room, and as a result there could be different results that come from therapy. It's also worth considering things such as mental illnesses, disorders and personality disorders. Therapy can be hugely beneficial for these demographics as well, but can take on a different format. We can also look at therapy in medicalised treatments, for example in brain injuries. Now, for a year or so, a couple of years ago, I worked as an assistant psychologist at a brain injury unit, and we had a couple of therapists that actually worked in the unit there as well. And their job was to try and help those that had suffered from brain injuries come to terms with their new lives. Now, it goes without saying that this was a completely different context and new format for those therapists, because patients with brain injuries often suffer from different challenges that people that regularly access therapy wouldn't suffer from. So, what exactly are the benefits of therapy? Well, research has ascertained that therapy can be hugely beneficial for individuals time and time again. And often that same research states that therapy can be arguably the most impactful, the most positively impactful form of treatment for those suffering from things such as depression and anxiety. Research also talks about antidepressants and the combination of antidepressants with talking therapies. Now, I know this from conversations with people and from my own clients that people can be averted to actually taking antidepressants. They're worried that there's going to be side effects, that they're going to get hooked on them, or that there's going to be different kind of consequences and it might alter their mind state. However, what is suggested in the research is that the combination of antidepressants and therapy can be hugely beneficial when it comes to people's mental health and well-being. So what is it exactly about therapy that works so well? First and foremost, for me anyway, is the relationship between the therapist and the client. Now, that's a very person-centered therapeutic viewpoint, and if you look up work by Carl Rogers, you'll know a little bit more about person-centered therapy. But that relationship and the developing bond between therapist and client is vital if any good therapeutic work is to be done. Now, what person-centered therapy talks about are primarily a lot of different concepts, a lot of different conditions, but there are three main conditions that the therapists themselves have to hold in order to develop that relationship. And they are empathy, congruence, and unconditional positive regard. Empathy basically means the therapist's ability to try and put themselves in the client's shoes and see things from their point of view and be able to communicate that to the client. The other is, like I said, congruence. That's where the therapist is able to be as honest and truthful with the client about their process and about how therapy is going and all manner of other things as much as possible. And unconditional positive regard refers to the therapist's ability to show warmth and value to the client as much as possible, to be accepting of them regardless of whatever it is that they bring. And what I would say is that although there are different approaches to therapy, some of which we'll go into in just a couple of minutes, the centrality of the client and putting the client at the center of the work where that relationship is key and develops session on session is what is going to create the most positive therapeutic benefit. There's a concept in therapy called the DODO effect, and that's basically where each approach to therapy, no matter what it is, often shows the same results. The research infers that no matter how or in what manner a therapist works in, it's the relationship between the therapist and the client and that developing bond and actually being in therapy in general, having someone to talk to and having someone to relate to is what causes great positive benefits in therapy. So we've talked on this a little bit, but let's look at the different approaches that there are to actually working in therapy. And what I would say is that there's probably more than we can count. I'm not going to mention them all in this video. Cognitive behavioural therapy and person-centered therapy, which we've already mentioned, are probably two of the most common. There's also EMDR, emotion-focused therapy, and psychodynamic therapy. There's transactional analysis and compassion-focused therapy, just to name a few. And all have sometimes very different agendas, sometimes they have very similar agendas, but they often have different outlooks on therapy and what actually works and what kind of process the therapists themselves should utilise in order to get the best benefit for the client. Now, this is one of the ways in which I think that counselling psychology, which I'm trained in, works really well because we're trained in what's called a pluralistic stance, which means we're actually trained in multiple different approaches of therapy to be able to combine them to create a stance, like kind of subjective stance to therapy and actually conducting therapy sessions. So we've looked a lot at what therapy is, the different types of therapy, the benefits of therapy, but how should you choose a therapist and how best can you choose a therapist? What I would say here first is that it's important that you have a therapist that you connect well with. You have to like your therapist. What I would also say here as well is that you have to ensure that they're fully qualified. I think this is something that's really important and can be often overlooked. Ensure that your therapist is accredited. Like many other professions, sometimes there are therapists out there who advertise themselves as counsellors or therapists and actually aren't fully qualified. So I would ensure and advise you to make sure that you check the credentials of the therapist that you want to utilise. And the final question that you're perhaps asking is that, should I be in therapy? Now, without shocking you too much, my answer more often than not is yes. And I say that because I think everybody can benefit from therapy, regardless of the position that they're in. My advice here is for you to give it a try. Contact a local therapist, maybe you could go privately, try out a couple of sessions and see what comes up and take it from there. Okay guys, thanks so much for watching this week's episode of getPsyched. This week we've been looking at therapy We've been looking at what exactly therapy is all about, the benefits of therapy, and what you should be considering when accessing therapy. Thanks again for watching, guys, and hopefully catch you next week.